We're in Netcong, New Jersey, at the headquarters of Atlantic Ambulance Corporation with their fleet of air ambulances. And we're here to get a sense of what medical evacuation is all about in a helicopter. The helicopter has become a crucial part of our ability to evacuate the most critical patients to the destination they need to go to, specifically to the hospital. And we know that when seconds count, between life and death sort of situations, this is where we want to be. In order to get a real sense for what this is like, we have created a mock scenario where we have an injured patient that we need to transport. So what we're going to do is simulate that to give you guys an idea of what it's really like to be in the hospital. He's going to die without an operation. He's in a hospital in upstate New Jersey that cannot deal with this problem, and we need to get him moved quickly to a hospital that's capable of taking care of this. Okay, we are simulating an emergency right now in a northern New Jersey hospital. This is a mock patient that we've created that has a catastrophic cardiac condition called an aortic dissection. This is the exact same problem that killed Richard Holbrook and the actor John Ritter. The problem with this condition is that if we don't get him to a hospital that can take care of a cardiac emergency right away, he's going to die. This is an absolutely fatal injury. Not all hospitals like this one can take care of this problem. We've got a hospital that happens to be my hospital, Morristown Medical Center. We're 30 miles away. We're the closest hospital that can deal with this sort of problem. It's not realistic to put him in an ambulance right now. God only knows how long it may take us to get there. So we're preparing to evacuate him on the helicopter. We've simultaneously initiated the sequence of events at Morristown. So I've got a team of nurses setting up an operating room. I've got an anesthesiologist ready to go.
Thanks. Moving.
And I come into the hospital so that simultaneously we get here.
We're going to lower your head down a little bit.
We've got about an hour to take care of this problem. And in the trauma world and in critical care medicine, we call this the golden hour, where we've got to take care of things right away, and this is exactly what we're doing. We've also got a philosophy here in the United States called scoop and run. And we've got trauma victims. We've got someone who's sick. Our goal is to get them to the hospital as quickly as we can. We don't dilly-dally in the field. That's very different than the way things are done in Europe. Some people have speculated that that's part of the reason that Lady Diana didn't survive. She spent an hour at the scene of her accident before they even left, and an hour and 50 minutes before they got to the hospital. In America, that wouldn't have happened. We would have had her in an ambulance, we would have scooped her up, and we're ready to go. So we're ready to go here. I'm going to hop in, we're going to go hot in just a minute. We're loaded up, we've got our paramedic, we've got our flight nurse. Morristown knows we're coming. We're ready to go hot.
Ready to Roger 03 in the belts, ready to go. Everybody ready to go? Roger 03, ready to 04, ready to go.
we can be cutting within 3 minutes. That's what saves lives. And now it's the transition point where we're going to hand off this victim to our cardiac team. This has been completely choreographed. We've got an anesthesiologist down there. We're ready to go. This is baseball the way it's meant to be played. This is how you save lives. Everything is smooth as silk. We get him down to the operating room, we're ready to go. As I said in the helicopter, we can be cutting in 3 to 4 minutes. Thanks for coming on board. For ABC News, I'm Dr. Chris Magovern. See you next time.